Prathima Radhakrishnan, and I'm a practicing fetal medicine specialist in Bangalore, which is in the southern part of India. The first trimester scan, or the NT scan, which is performed between 11 weeks and 13 weeks and 6 days, is a very, very important scan, and every pregnant mother deserves to have this scan. The reason being, the baby is fully formed by 11 weeks. The head, the body, 2 hands, 2 legs is all formed. So if there's any major structural problems, we can pick it up at this stage. Now, various research groups across the world and even in India, we have established that about 50% of major structural problems can be detected at this stage, provided we know what we are looking for. The first trimester scan, or the NT scan, is also a very important scan to assess the risk for carrying a baby with a chromosomal problem. Now, the most common chromosomal problem is Down syndrome, and Down syndrome is also the most common form of non-inherited form of mental retardation. Any woman and every woman is at risk of having such a baby. As a woman grows older, the risk of having a baby with Down syndrome increases. For example, at the age of 25, your age-related risk of having a baby with Down syndrome is about 1 in 1,000, 1 in 1,200. But by the time you reach 35, the risk of having a baby with Down syndrome is about 1 in 300. And by the time you reach 45, because now more and more women are having children at later ages as well, the risk becomes 1 in 50. Majority of the women at the age of 45 will still have normal babies, but the probability is a bit higher. What can we do for it? Now, the first trimester scan, or the NT scan, is the best time to assess the risk of the baby having chromosomal problem. We look at the mother's age, we perform a scan looking at the thickness of the neck, looking at the blood flow at the heart, looking at the presence or absence of the nose bone, and we put all this into a calculator which calculates the risk of the baby having a chromosomal problem. Whilst looking for Down syndrome, we are able to look at other chromosomal abnormalities as well, like trisomy 18 and trisomy 13, depending upon the presence or absence of other structural problems or markers on the scan. Now, this scan can be combined with a blood test called the dual marker test, where we measure 2 hormones in a specific manner, combine the hormones along with the scan, and this gives a 90 to 92% detection rate or accuracy for determining whether the baby is at a higher risk of having a chromosomal abnormality or not. Of course, this is only a probability, but it is very reassuring if your probability goes down or is a very low risk, versus if the probability comes up as high risk based on the parameters, then you take it further by doing a confirmatory test, which would be more invasive test as well. And this has to be obviously discussed with your obstetrician and with the fetal medicine specialist, because they are the ones who actually look after these babies and ensure the well-being of the baby.